longer in production, but it's called the Aquasizer. And the Aquasizer was made by a German fellow who's now left the country. And his molds, unfortunately, got destroyed when he left. But these are state-of-the-art ozone delivery systems that simply wash your body with, as you lay in it, it washes your body with hundreds of little jets filled with warm, ozone-charged water. So your pores open up, the ozone goes in through the pores, in through the skin, the body sweats out the toxins, the ozone burns up the toxins. So it's ultra-pure water, highly charged with oxygen and ozone. It's a wonderful, non-invasive way. You can go to a beauty clinic and get oxygen ozone put through into your body this way. We've tested people who've had elevated oxygen levels in their blood for days afterwards. And then one guy, while he was being tested, decided to drink a beer. Immediately his oxygen level dropped. Let's look at what the doctors are saying about what ozone does when you apply it to the human body. Here's the generally accepted effects of traditional ozone therapy. It chelates heavy metals, works well in conjunction with EDTA, cleans arteries and veins and improves circulation, improves brain function and memory, takes the scum off the brain cells. It activates viruses, bacteria, yeast, funguses, and protozoa, normalizes hormone and enzyme production, oxidizes toxins, allowing their excretion, prevents and eliminates autoimmune diseases, prevents and treats communicable diseases, prevents and reverses degenerative diseases, prevents stroke damage, purifies the blood and lymph, reduces cardiac arrhythmia, reduces inflammation, reduces pain, calms the nerves, stimulates oxygen metabolism, stimulates the immune system, stops bleeding. Frank Schallenberger, MD in Nevada, he's on the Nevada Medical Board, he says there's 13 major effects of the ozone he has observed on humans in his clinic. Number one, ozone stimulates the production of white blood cells. That's your immune system. Number two, the interferon levels are significantly increased. Again, your immune system boosted. Number three, ozone stimulates the production of tumor necrosis factor. Again, the immune system up. Ozone stimulates the secretion of interleukin-2. That's one of the cornerstones of the immune system. Up. Ozone kills most bacteria at low concentrations. That's what I've been telling you. Ozone is effective against all types of fungi. Absolutely. Ozone fights viruses in a variety of ways. Ozone is anti-neoplastic. This means that ozone inhibits the growth of new cancer tissues. Ozone oxidizes arterial plaque. Ozone increases the flexibility and elasticity of red blood cells. Ozone accelerates the citric acid cycle, also known as the Krebs cycle or TCA cycle. Ozone makes the antioxidant enzyme system more efficient. Ozone degrades petrochemicals. It's there in the literature. Ozone concentration used mostly in medicine is 2%. Ozone, 98% oxygen. Pure medical grade oxygen. 2% equates to 27 micrograms per cubic milliliter. Some people use 42, which is about 3%. The upper limit comes out at probably about 5% of most people using it. There's some talk that above 80, it may not be good for weak, feeble, diseased, or dying cells. And so you'll see some cell damage when you go above 80 micrograms per cubic milliliter. That's only the ozone taking out the dead, weak, feeble, diseased, and dying cells like it's supposed to. They're on their way out anyway. This also means, if we apply it correctly, the end of anybody contracting any disease from a transfusion. How many people get sick from transfusions? As I've said, you take ozone, you put it into stored blood, it turns the blood cardinal red, and flocculates or drops out of solution all the toxins, the bacteria, the virus, and funguses, kills them all. Well, I know some people that went to the Red Cross and said, hey, we can purify all your stored blood. They said, oh, maybe so, but you're first going to have to pay us. I think they wanted $500,000 or something. They wouldn't even look at it. They wanted money. Ozonated water for washing infections, that sort of thing. Body washing, we already told you about the Aquasizer. In dentistry, it's being used. Ozone's being used in dentistry. In Russia and England, they put these cots over the tooth, put the ozone in. When they take out all the old infectious matter and stuff, it kills all the bacteria. And then you can close the tooth up and never get an infection from it. As I said, you could put it in your ear, you can put it in your vagina if you're a woman. Many women do that daily. Rectal insufflation, it's an easy way to get it. I used to be standing there with the rectal catheter and be putting ozone into my colon while I'm brushing my teeth and combing my hair in the morning because I was in a hurry. Injections, drips, minor autohemotherapy. Well, minor autohemotherapy, that's when a doctor will take out a little bit of blood, put a little bit of ozone in it, create like an immune vaccine, and then inject that back in. It has some benefit, but it's nowhere near as effective as the other things. Muscle injections. Well, people do inject in the muscles, but that's mostly painful and ineffective, according to Dr. Auberg in the 1930s. Varicose vein injections. It bleaches out the varicose veins from what the doctors tell me. Tumor injections. I've talked to clinicians and interviewed them. They injected ozone to tumors. The tumors dried up and shriveled up from the inside. Portal vein injections. There's a Dr. Turska that perfected portal vein injections. He injected the ozone into the portal vein by opening up the anal opening, going in there with a hypodermic needle, putting the needle into the portal vein, branched out right to the liver, totally purified the liver, cleaned out the whole liver and everything that was wrong with the liver. This is a method that I came up with to take away a lot of the disadvantages of the single catheter method. This is called the two catheter method for ozone rectal insufflation. See, there's two catheters up into the anal opening, and the ozone comes in, goes up into the colon, it's absorbed into the colon, and then the waste gases and whatever else doesn't belong in there simply drips out. The exit catheter is much larger diameter, so the waste just kind of drips out. Usually the patient is laying on a towel when this happens. But the advantage of this is unlike the other methods, which are like 2 minutes or so with a single catheter. You hold it in there, you get a lot of cramping, that sort of thing. With this method, as long as the colon is clean beforehand, so you'll do like an enema or something. As long as the colon is clean, you can lay there for an hour. I've done it. Just laid there for an hour with ozone going into my colon, waste gases and oxidized matter coming up. There's no pressure buildup that way. The top 4 ozone clinical delivery systems, I'll explain completely thoroughly in my book. Major autohemotherapy. The Germans are experts at this. They take out maybe 500 milliliters of blood. So they have a vacutainer on a little pole with a jar full of blood sitting there, and they take the blood out and put it up there into the jar. Well, you can see it. It's brown, it's black, it's purple, it's dark, it's filthy. Then they come along and they put ozone in there. Put lots of ozone in there. It turns cardinal red. They gently swish it around, and then they drip it back into your arm. Well, it does have a lot of benefit. There's thousands of studies in the German literature showing its effectiveness, but it's inefficient because you can only get so much in, and you're taking all the garbage that was in the blood and you're putting it right back in the body. All right, the second way, let's call it, similar to that, used by the Russians, is ozonated saline. They simply take biological, physiological saline, they ozonate it, and they drip it into the bloodstream. Very safe. Not very effective in the present form because they only use 10 micrograms per cubic milliliter, so they're using maybe less than 1% ozone. It has benefit in the long run, but it takes far too many treatments. They should take a clue from all the American doctors doing the IV work for the past 10 years, which are using a minimum of 27 micrograms or 2% oxygen, 2% ozone, 98% oxygen, and they're simply injecting it, just injecting it right into the arm. And if it's done very, very slowly and the patient is lying down, again, it's fully described in the book, but if it's done very slowly and the patient is lying down, there's never been a problem. And the advantage of this is you can get a lot more in than you can with the autohemotherapy or the saline drip. The disadvantage of this method, besides from the fact that it's easy to do, you just fill a syringe and you inject, butterfly needle, 25G. That's really simple. It can be done anywhere in the world. Very portable, no big equipment. The disadvantage of all those methods is they still leave all the garbage that's being oxidized, all the bacteria, virus, fungus, pathogens that are being killed. They still leave them in the body for the body to have to filter, adding greater stress and toxins into the body in a different form, and they must be flushed out. So people go through a lot more heavier detoxification reactions as the oxidized particles create symptoms of different things bothering you as they come out. Much better than that. This is the best of the best. Very rare, very hard to find because it's so new, it's cutting edge. You simply take blood out of one arm. It comes out, it'll be like a dark purple, dark black. Take blood out of one arm, ozonate it, filter out all the residue, all the sediments, all the dead bugs, all the toxins, filter it out, and then take the clean, pure, sterilized, bright cardinal red blood